Hey, what's going on? It's Dr. Bob. Hey, I wanted to share with you, we had a patient on Friday, and she was asking about her, I think it was son or daughter, wasn't my patient, that, to adjust kids and the safety of it, and would she do it, and how does it work? There's a lot of questions. So my two kids happened to be here on that day. So we said, hey, let me show you. So I brought them over to the table, and I love adjusting kids because they're so much easier than us adults, and they're smaller, and I can just use my arms rather than having to use my body. I've adjusted them since they were 1 day old. Totally different type of adjustment for a baby. It's like testing the ripeness of a tomato. It's just some pressure points and some traction and belly adjustments for colic and just overall kind of nervous system checks. I have a couple of different patients that come to mind that just had fantastic results, because sometimes they come out with what's called torticollis coming out. It can be pretty traumatic. So from babies to little kids, my kids are 7 and 10, so they're fun to adjust. That's the age that I really enjoy. So I pointed out something. I said, there's a lot of studies that show about the change or the enhancement on the immune system after chiropractic adjustments. It does not make you immune superior. It does not protect you from any type of specific said name viruses that are out there. But it shows that for a temporary time that there's an enhancement to some degree of the T cells marked with, doing blood work. So I did point out that my kids, this past winter, if you ask any teacher, this was one of the worst flus for kids. Schools were wiped out. 60% of classes sometimes didn't happen. I think one school, actually like the whole grade, they just shut down for a week because there were so many kids that were missing. It was a pretty bad flu season. My kids did not get the flu. They didn't miss a day of school. They didn't get sick. They do get sick, but I adjust them right away, and it usually prevents them from having some type of full-blown problem, whether it be the adjustments, whether it be their diet, whether it be, I don't know. But if you ask my kids, they're funny, because if he goes, I have a bellyache or I don't feel well, first thing I say is lay on the table. I adjust them immediately. So I adjust them probably at least once every 3 to 4 weeks. Unless something is going on, I adjust them much more regularly. So just my story about how I do with my kids and how I think chiropractic can help kids as far as from the natural wellness standpoint on keeping them healthy and making them possibly a little bit more higher functioning. A lot of good results with different systems in the body, on top of pain. Sometimes they get pain and headaches and stuff like that. So if you ever have any questions, please hit me up. Let me know. I'd love to talk about it. I love adjusting kids.